Welcome to Spinal Moves, a Canadian series about activity-based therapy, a novel intervention used to improve recovery for people with spinal cord injury. In this series, Anita Kaiser and I will chat with people who have a spinal cord injury, therapists who work in neurological settings, and researchers who study activity-based therapy. I'm your host, Hope Jervis Rademeyer. Today's episode is an introduction to activity-based therapy and features two guests, Dr. Kristin Musselman and Kristen Walden. Dr. Kristin Musselman is a physical therapist, assistant professor in the Department of Physical Therapy at the University of Toronto, and a scientist at KITE Toronto Rehabilitation Institute. She completed a PhD in rehabilitation science at the University of Alberta and was a postdoctoral fellow at the Johns Hopkins School of Medicine and Kennedy Krieger Institute. The overarching aim of Dr. Musselman's research is to develop innovative, clinically feasible approaches to restore movement, function, and participation for individuals living with complex neurological disease across the lifespan. Something you might not know is that she had always planned to be an accountant, but ended up choosing physical therapy. Welcome, Dr. Musselman.
Thanks, Hope.
So, Dr. Musselman, you're our very first guest on the first episode of Spinal Moods. And we're going to talk a lot about activity-based therapy in the coming weeks. And some of our listeners might not know exactly what it is. So with that in mind, can you tell us what activity-based therapy is and how it applies to someone with a spinal cord injury?
Sure, happy to do that. So activity-based therapy is a therapeutic approach that's quite focused on neurorecovery. So it includes activities where you're aiming to get neuromuscular activation of parts of the body that have been affected by neurological damage. So in the case of somebody who sustained a spinal cord injury, we're aiming to target areas that are below the level of their spinal lesion. So for example, if it's an individual who's living with paraplegia, this would include movements or function that includes the trunk and the lower limbs, such as gait training, standing training, lower limb cycling. For somebody who is living with tetraplegia, this might also include activities that engage the neuromuscular function in the upper limbs and specifically the muscles that have been affected by the spinal cord injury. So it could be arm cycling or repetitive practice of reaching and grasping, for example. And as I mentioned, it's really focused on neurorecovery, and really our understanding of activity-based therapy and the way it's evolved, it's really evolved in tandem with our understanding of neuroplasticity and what the nervous system is capable of following neurological injury. So the therapy and the approaches are really based on those principles of neuroplasticity, which you can think of as sort of the ingredients that we want to have in our therapy programs in order to promote change in the nervous system. For example, engaging in task-specific movement practice that has a high dose. So this could be a high number of repetitions. It could be a high level of cardiovascular training, but also a high level of motor challenge. But activity-based therapy is not just focused on neurorecovery. So there's some other goals of this therapeutic approach. So for example, to reduce the occurrence of secondary complications that are associated with spinal cord injury. So reduce the incidence of pressure injuries or pulmonary complications, for example. And then also because many of the activities that would be considered ABT involve a moderate to high level of cardiovascular training, they also can help to improve physical fitness. So that also is a third goal of ABT.
You've mentioned a few things in there. So for example, the intensity, managing secondary complications, and a lot of key differences between exercise and activity-based therapy. So are there any more differences that would exist between activity-based therapy and exercise?
Yeah, that's a great question, because I agree it's two concepts that can be a bit confusing, and there actually is quite a bit of overlap between exercise and activity-based therapy. But I think maybe we'll step back and just talk about what are the definitions and what are some of the key differences. So exercise, it's structured and repetitive physical activity that's performed with the intent of improving physical fitness. So typically, if you're engaged in exercise, you're aiming to reach those sort of moderate to high cardiovascular training levels, and fitness is the primary goal. With ABT, as I mentioned, fitness can be an important piece of why you would engage in ABT. But along with ABT, it's that engaging the neuromuscular system in areas of the body that have been affected by neurological damage. So, you could have an activity that would be considered both exercise and ABT. So to give a concrete example, somebody who's living with paraplegia who participates in an FES rowing or cycling, lower limb cycling program. So through that program, they're going to be engaging in cardiovascular training, but at the same time, they're going to be engaging parts of their bodies that have been affected by injury, whether that's voluntarily or also with in this case, the addition of electrical stimulation to try to help get that neuromuscular activation. So is an example that would be both exercise and activity-based therapy. But, it's also possible to be engaged in exercise and that activity not be considered an ABT. And in that case, it's because, the exercise is not targeting parts of the body that have been affected by injury. So if you take the same individual with paraplegia and instead to improve their fitness, they're engaging in arm cycling, for example, that would be exercise, but wouldn't meet our definition of ABT.
Okay, thanks for clarifying that. So with this discussion about ABT, when did you first learn about activity-based therapy and what was your initial impression?
Yeah, so I think probably the first time I heard the actual terms activity-based therapy would have been about 10 years ago. And as you mentioned, part of my postdoctoral training was based at the Kennedy Krieger Institute. And of course, the Kennedy Krieger Institute has been a leader in the development of ABT, especially for those with spinal cord injury. So I think during my postdoctoral training, I remember attending, it was just a small conference, very clinically focused on ABT. So that was really my first exposure. In terms of my impression, to be honest, I think it was a bit confusing at first, because I think as you're starting to learn about ABT, there can be some confusion about what activities truly are ABT or what's exercise or leisure time physical activity or these different terms. And maybe also a bit of confusion just trying to understand how ABT differs from what we've traditionally or more commonly have been doing in our neuro rehab with our patients. Since then, I've really come to understand that it's an approach, or you could even say maybe a philosophy towards therapy post-spinal cord injury. So it's become much clearer. But also to answer that question though, that was the first time I heard the term ABT. But the reality is I was immersed in ABT well before that term even existed. So I'm thinking back to 2003 when I started my graduate training. And throughout my graduate training, I studied locomotor training programs for people with spinal cord injury. So body weight supported treadmill training. And also we developed a couple overground gait programs that were really grounded in theories of neuroplasticity. Really those are activity-based therapies as well. And so without really knowing it at the time, because I think that the term activity-based therapy hadn't really been developed yet. I mean, it has existed for the past few decades. I know for sure my impressions of that area of work and locomotor training, I was very excited by it as a new grad student. I think for a couple of reasons. One is that bodyweight supported treadmill training was such an amazing example, possibly one of the best examples we have in rehab of that really effective bench to bedside translation, where work that had been pioneered in animal models of spinal cord injury and tested was then translated successfully to an effective therapy for those with spinal cord injury. And I think the other reason is it really, bodyweight supported treadmill training was a disruptor to the way that we approached rehab after spinal cord injuries. So it was an intervention that really made us become aware of what individuals with spinal cord injury were capable of in terms of their recovery post-spinal cord injury. And I think it really accelerated that switch from a more compensatory approach in our rehab to a more neurorecovery or neurorestoration approach.
That's very interesting because I have a similar story. I first came across really activity-based therapy when I attended the Activity-Based Therapy Summit that you were a part of creating in 2019. Can you tell us a bit about why the summit was created? Who was there and what were some of the main ideas or actions that came out of the summit?
Yeah, absolutely. So as you mentioned, the summit was something that was a large group pulled together in 2019, and it was a fantastic event. It really occurred because there was an identified need to talk about access to activity-based therapy for Canadians with spinal cord injury. And this need was really identified by people living with spinal cord injury themselves. It was the Praxis Spinal Cord Institute that initiated this event, where it was Dr. Vanessa Noonan and Kristen Walden, along with myself, that organized it and co-hosted it. And we held it in Toronto. And the goal was to bring together a group of individuals who have different interests or stakes in activity-based therapy, so different stakeholder groups. So there were about 40 or so individuals from across Canada that came to Toronto in March of 2019. And so these were individuals with lived experience. There were, researchers such as yourself in a variety of different areas, so researchers in rehab, biomedical engineering, behavior change, economic analyses. We had hospital administrators, frontline therapists, trainers at community ABT clinics, funders, and also experts in public policy. So we brought this group together, and our main goal in the day and a half meeting was to come up with priorities or goals, you could say, for activity-based therapy in Canada that would extend over sort of the next 5 years. That is what we were able to accomplish in that day and a half, is we were able to come up with 5 goals that we would focus on in order to try to improve not just access to ABT, but also the quality of ABT and ABT research that is being pursued in Canada. So those 5 goals that were originally developed included things such as, first identifying what is currently being done in Canada with respect to activity-based therapy across the continuum, from acute care to rehab into the community environment. Secondly, is to develop a network so that we had a means in order to share information about ABT across this continuum of care. We also identified the need to develop tools that could track participation and progress in activity-based therapy, to develop some guidelines that could be used and shared with clinicians. What's the state of the evidence with respect to ABT and how could it be incorporated into practice? And then lastly, more of a research-focused priority, but was to start examining the optimal timing and dose and also the optimal methods of ABT for those living with spinal cord injury. So after identifying those goals, we've split into smaller working groups that have been over the past year and a half working towards achieving some of the steps towards those larger goals.
Great. Yeah. In a future episode, we're actually going to learn a little bit more about the research coming of that. One final question for you. You mentioned that individuals living with spinal cord injury find that this activity-based therapy is very important. But why do you think it's crucial for Canadian therapists to start using activity-based therapy now?
Yes, that's a great question. And I think maybe what I would say in response is I think the first thing that needs to happen is an increased awareness and understanding of what ABT is. As we've talked about, it's a relatively new concept. So even if we can increase awareness and knowledge of ABT among therapists, so that's sort of the piece that I think is crucial at this point. After that happens, I think the use will naturally flow from that, which is ultimately what we're hoping to achieve over, let's say, the next 5 to 10 years. Reasons why I feel that it's important to be aware of what ABT is, so current clinicians, but also future clinicians. So, we are aiming to target not just those who are already out practicing, but even what our students are being taught in their physical or occupational therapy programs currently in our academic programs. But there's a couple of reasons why that knowledge is important. So one is it's evidence-based. So there's a very strong body of scientific literature that supports these approaches to therapy that would be considered ABT. And we know they can have many positive outcomes for people who live with spinal cord injury in particular. So, improved mobility or improved upper limb and hand function, improved bowel and bladder function, and increased quality of life, for examples. So that's one reason. And the second reason is that this is an approach that through some of the previous research that we've done, we know that it's an important piece of what they call their lifelong rehab journey. So they see ABT as something that they would continue to engage in over the long term. And so I think it's important for clinicians to learn more about ABT and figure out how they can guide their clients in order to achieve that longer term vision of, being engaged in rehab and ensuring that they reach the fullest potential that they can.
Okay, well, thank you so much for coming in today, Dr. Musselman, and telling us a little bit more about ABT. And best of luck in your future research.
Well, thanks so much, Hope, and thanks for doing this podcast. I'm really looking forward to hearing all the different issues you come out with.
Kristen Walden is currently a National Clinical Liaison for the Praxis Spinal Cord Institute and a physiotherapist at Vancouver Coastal Health. Clinically, she has practiced in the area of SCI for over 19 years, working with individuals in intensive care, acute care, as well as both inpatient and outpatient rehabilitation settings. In her role at Praxis, Chris works on a number of research and best practice initiatives with the aim of improving care for individuals with spinal cord injury or disease across the country. Years ago, she was able to deliver medical equipment to a village in Vietnam, which required a lot of creativity in doing wheelchair fitting, but was an amazing experience for her to see the impact basic equipment can have for people. So welcome, Kristen, to our show.
Thank you.
So our first question for you is, can you tell me a little bit about the first time that you heard about ABT?
I first heard about ABT during my work as a physiotherapist at GF Strong, so a rehab hospital here in Vancouver, Canada. A new private community clinic had opened and some clients were attending as outpatients to receive this thing called activity-based therapy. And I'd heard from clients that they were attending 4 and 5 days a week, which was quite costly for those paying out of pocket. And they expressed having really high hopes for gaining additional recovery from their injuries through this type of therapy. I didn't know a lot about the activity-based therapy at that point, and I was surprised to see that there were no physiotherapists involved at this particular clinic, and there wasn't a lot of communication between the rehab hospital and the clinic. So as therapists at the hospital, we weren't quite sure of the theory or the specifics of the program being offered, which made it challenging to inform or advise our clients about starting this type of therapy. So that exposure of hearing about this activity-based therapy really made me want to learn more about the theory behind it and the research behind it.
Interesting. That's quite true with a few of our guests where they didn't really even know what activity-based therapy was until they kind of stumbled upon it in a clinic somewhere. Mm-hmm. Obviously, you have an extensive clinical and research background now surrounding rehabilitation for people with spinal cord injury. How did ABT in particular capture your attention compared to other therapies for people with spinal cord injury?
Yeah, good question. After beginning my role at Praxis, I started to look more into the research behind activity-based therapy. So like I said, I'd heard about the term and didn't know a lot about it. And at that time, more research was coming out in the area that showed improved outcomes. And I started to learn that the theory behind it is defined by some similar principles to those to promote activity-dependent neuroplasticity or changes in the nervous system that you can achieve through activity. And it combines similar components to things that I'd seen some success with in my clients at GF Strong. So things like using repeated practice of challenging and task-specific movements, or sitting to standing or reaching and grasping, while providing some kind of sensory stimulation in the affected area of their body, like weight bearing. And so that alignment with what I'd seen some success with and the outcomes being reported after participating in ABT, combined with really just the potential of having a type of therapy that might be able to better promote recovery of neurologic function instead of just looking at what an individual already had available or looking to equipment or different ways to accomplish a same functional goal, was really exciting.
Mm-hmm. So as we found out, and as you just mentioned, you are the National Clinical Liaison for Praxis Spinal Cord Institute. So can you tell me a little bit more about Praxis and what the organization does?
Sure. Praxis itself is a Canadian-based not-for-profit organization that really leads global collaboration in spinal cord injury research, innovation, and care to accelerate the translation of discoveries and best practices into improved treatments for people with spinal cord injuries. And we work on a framework that has 4 priorities. So the first is engaging consumers. And there's a Praxis consumer program that follows an integrated model to engage the spinal cord injury community to become more involved in research, healthcare, and advocacy. The second is accelerating research towards a cure. So the Praxis Cure program works to support work leading to the better diagnosis of and promising treatments for spinal cord injury. So some areas of focus for that program include the development of different neuroprotective and neurorestorative therapies. So things like activity-based therapy, spinal cord stimulation. The third priority is really improving spinal cord injury care across Canada. And the CARE program aims to achieve equitable and really optimized care across acute care, rehab, and through into the community for people with spinal cord injury. One example through that program is working with Accreditation Canada to develop spinal cord injury specific standards for both acute care and rehab hospitals, and then working with those hospitals in Canada to support their use. And the last priority is really increasing the development and commercialization of different innovations. And the Praxis commercialization program aims to accelerate that research to implementation pathway for different innovations or devices that are relevant to people with spinal cord injury.
So Chris, what is the role of Praxis in bringing ABT to Canada?
Well, ABT was identified as a priority area from individuals with spinal cord injury initially, which really led Praxis to collaborate with Dr. Kristin Musselman on a Canadian Activity-Based Therapy Summit. And that summit really resulted in an action plan to kind of inform how to move the field of activity-based therapy forward here in Canada. Since the summit, Praxis has been participating in and supporting the work of the group, which has now kind of become the Canadian activity-based therapy community of practice. Praxis has supported a recent ABT Expo, held open calls for ABT-related grants, and collaborated on other competitions related to those priorities identified at the ABT Summit.
Interesting. So you've given a great description of the role of Praxis and how they've brought ABT to Canada as well. You were also one of the individuals involved in creating the recent Canadian activity-based therapy community of practice. So what is this group and what is their most important goal?
Yeah, the Canadian activity-based therapy community of practice is really a group of people with a variety of different backgrounds that share an interest in activity-based therapy, who are working together towards the priorities identified as important and feasible to move the field of ABT forward here in Canada. So having that community of practice really provides us with a mechanism to promote communication and encourage collaboration, and really so that we can work together to accomplish these priorities much more effectively and efficiently. So the ultimate goal of the community of practice really is to improve the quality of and the access to activity-based therapy in Canada in order to maximize both neurorecovery and to minimize related secondary complication. The group is still fairly new. It's open to anybody who has an interest in ABT, and it currently has about 30 members and a steering committee that leads their work.
Great. So for those of you who are listening, you're welcome to join the community of practice. Now, we talked a lot about different organizations you belong to and you're part of. So a lot of them are really focused on implementation of ABT in Canada. If we successfully implement ABT in Canada, what do you think is the potential impact for individuals with SCI? And why is it important right now to implement ABT for Canadians?
I think the potential impact is really to help facilitate maximum neurological recovery after spinal cord injury, allowing people to kind of reach their maximum potential after spinal cord injury. And in terms of timing, I think now is really the time, first and foremost, because it's been identified as a priority by individuals with spinal cord injury. And I think we've seen a shift in rehab that's tended towards shorter and shorter lengths of stay in an inpatient setting. And so the goals in that inpatient setting have had to shift towards maximizing people in their independence through any means possible, instead of being able to have the time to focus on maximizing their actual neurological recovery. And on the other hand, there's a lot of research going on showing positive results with activity-based therapy. And there's a lot of new technologies being developed that can help kind of facilitate the delivery of ABT. So I think now is really the time to start to implement the things that we know, as well as learn more about what aspects of ABT are required in order to kind of maximize these gains for people, and at what timeline post-injury they should be implemented so that it fits within our current healthcare system, but also within the lives of people with spinal cord injury to make sure they are reaching their maximal potential.
Yeah, it really is important, I think, to implement ABT for Canadians. Thanks, Chris, for coming onto the show today. It was great to hear about Praxis and the community of practice, and best of luck in all of your roles and bringing ABT into Canada in the future.
Thank you. I look forward to the podcast.
Thanks for listening. Our next show will feature 3 guests living with spinal cord injury who use ABT. One of these guests, Anita Kaiser, is also hosting some of our future episodes, so tell others and tune in. Speaking of tuning in, you can link to Spinal Moves and get more information about ABT and the Canadian Community of Practice at praxisinstitute.org. Or you can also listen to Spinal Moves on Apple iTunes, Spotify, and other popular platforms. This series is sponsored by Praxis Spinal Cord Institute, a Canadian-based not-for-profit that leads global collaboration in spinal cord injury research, innovation, and care. Special thanks to the Saskatchewan Centre for Patient Outreach. Spinal Moves was created by Hope Jervis-Rademeyer, produced by Hope Jervis-Rademeyer, Praxis Spinal Cord Institute, and Anita Kaiser. The information provided on Spinal Moves is of a general nature and cannot substitute for the advice of a medical or healthcare professional. The opinions expressed on the show are solely that of the host and individual contributors. None of the individual contributors, system operators, developers, sponsors of Spinal Moves, or anyone else connected to Spinal Moves can take any responsibility for the results or consequences of any attempt to use or adopt any of the information presented through this podcast.